If you want to get involved in hospice, volunteering is a great place to start. In this video, I'm going to be talking about how you can become a hospice volunteer. And once you are a hospice volunteer, where do you start? So, fun fact, all Medicare-driven hospice companies have to have a volunteer section. So they have to have volunteers. Every single hospice company, if they are using the Medicare benefit, which most of them are, they legally have to have volunteers. There's usually a big volunteer program, a volunteer push in most hospice companies in your area. So here are how the volunteers are utilized. There are many ways hospice volunteers are utilized. It can be through companionship, where you're actually working with the patient and their family, going into their homes, you're reading to them, you're writing letters for them, you're just talking with them. Or if you have certain certifications, you can do like aromatherapy, massage therapy, pet therapy. It depends. You also can support the families or provide respite for them. So you could come in, be with the patient while the family goes grocery shopping. Or you go grocery shopping for the family, or pick up coffee, or do light cleaning or light cooking. Depends on what you want to do. Of course, you don't have to do any of this stuff, but that is one way volunteers are utilized. They also can be a part of the bereavement program. So you can volunteer and be a part of the bereavement program. So after their loved one dies, supporting them that way, holding groups. However, that hospice company has their bereavement services working, you can volunteer in that bereavement program. Sometimes volunteers can do administrative duties, like calling patients and seeing if they need refills on supplies, or writing thank you letters to fundraising events, things like that. So it just depends on the hospice company. And lastly, there can be special services. So if you're a barber and you have, again, a certification, so you can cut hair. Or if you play music, you can volunteer as a music therapist. There's different things you'd have to work with the hospice company, but those things are allowed. So if you're interested in volunteering, a quick internet search will show you all the different hospices in your area. And all you have to do is usually go to their website and fill out interested in volunteering, and that would get the process started. Now, there are things that have to be checked off in order for you to even get involved in their volunteer program. They usually will have to do a background check. There usually is an extensive training and orientation program. You will usually have to have a valid driver's license. You usually have to show evidence of vaccinations, immunizations, just because you're working closely with people who are sick and their families. There's usually an age requirement as well, so it's usually 18 or above, or 21 years old and above. One thing I would like to say is that it's not uncommon for people who have gone through the hospice experience with one of their loved ones to want to give back and then start volunteering for hospice companies. Now, there is a requirement usually that they want you to wait for up to a year after your loved one has died before you start volunteering. If you now are a hospice volunteer and you're worried about how do I start this conversation, where do I go, what do I do? I'm going to talk about that in this next part of the video, but also remember that you're going to have an extensive orientation program before you're sent out to meet people. So please know that you will likely be prepared. So how to start the conversation? One, you always want to introduce yourself, say who you are, say why you are there. Ask them, how are they doing? Are you comfortable? Are you thirsty? All the things, making sure that they are not in pain, and that they're comfortable. Please know that it's not your job to make them comfortable, right? You can't give them medications, but you can always ask the nurse or call the nurse about something, or talk to their loved one if you're in their home. If you're reading to them or talking to them, just making sure they're comfortable. You can always keep the conversation light, right? You don't have to be a hospice volunteer and having profound conversations about death and dying. It may lead there, right? But you can talk about the weather. You can ask them about their family. Notice a picture frame. That's what I usually do. I notice a picture frame in the room. Oh, who's that? That's a beautiful picture. That starts into them talking about their family. Ask them where they're from. A lot of times I would suggest that you talk to the hospice you're working for. And if you know you're going to see a patient, ask them about that patient. Get their history, their age, who they live with, what's going on, right? So you kind of have a background. If you notice they love cars, tell me about your love of cars. How did that start, right? So it's about forming a friendship, not necessarily about having existential conversations about how they want to die or are they afraid of death. Now, it could lead to that, right? But it's mostly about just starting a friendship or a companionship. Some important questions people have are like, what if they ask me about myself? Am I allowed to say things about me? The answer is yes, and as much as you're comfortable with. You can talk about yourself as much as you're comfortable. You don't have to indulge everything. You can keep it surface level if you want, and it's just like a friendship, right? So as time goes on, you may end up talking more about yourself, but you can always keep it light and polite too. Boundaries with volunteering are really important, right? And sometimes it's going to be messy when you first start out, but eventually you're going to get the hang of it. If you are with someone and you start seeing, oh, they're really talkative, or oh, I can't seem to get out of there where I'm supposed to. There are things you can do to help with that. And it's okay to set boundaries, and eventually you're going to find your way with that. It's going to feel a little more comfortable. It might feel uncomfortable at first, but eventually it'll get easier and easier. How I do it a lot of times is when I first get there, I set the boundary of, oh, it's so nice to see you. I can't wait for see how you're doing. Da 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 da. Just so you know, I always say I have a hard out at 3:00 or whatever it is. Right? Give yourself 30 minutes, 45 minutes, an hour, just so they can already be prepared that you have to be leaving in 45 minutes to an hour or whatever you planned on. Then as time goes on, if they're still talking, you can give nonverbal cues of like listening to them, but putting on your jacket, kind of getting ready to leave so they get what's happening. And it's okay. It can feel a little awkward, but it's okay. You're allowed to take the time you need and then go when you need. And that will come over time. Mostly remember with volunteering is like you don't need to fix anything. You are just there to be. Silence is okay. And you're going to see through your agency, through the people they hook you up with, what's needed, right? Maybe you're not meant to be sitting there with the patient talking. Maybe it's better to be reading. Maybe it's better to be going grocery shopping for their caregiver, which, by the way, you won't have to pay for. You will see over time how you will be helpful, and your hospice company will help you with that. The one big thing you need to know is you are not supposed to or allowed to touch the patient. So you should never be giving care to the patient, never be turning them. You should not be changing them. You should not be giving medications. None of those things are your job, and you can draw a hard boundary with that. That is not allowed. You cannot do it, and that's totally okay. Another thing you cannot do is push your views on a patient. So I hope this is obvious, but just in case it's not, if you are with someone and they are not Christian, but you are Christian and your belief is that they need to be Christian or they're going to hell, that is not your place to tell them as a volunteer. It is really important you do not push your beliefs, spiritual beliefs, religious beliefs, political beliefs on that person. I do think over time, if you and this person become friends and you are chatting about stuff and they know your beliefs and they have differing beliefs, but you're having a fun debate about it, and that's the dynamic that you guys have established, I do think that's okay. I don't think it's okay for you to ask if you can pray for them, because if they ask you, will you pray for me? Yes, by all means, please go for it. But you should not ask them that, because you don't know where they're at or what they want. You don't want them to feel uncomfortable. The whole point of you being there is just to help and not push anything on them. So if you're watching this and wondering if you should be doing this, I would say try it out. You could always try it. If it doesn't work out, it doesn't work out. Particularly if you speak multiple languages, we definitely need people volunteering who speak multiple languages. Or if you have a special talent like music therapy or pet therapy, massage therapy. But again, you don't have to have any of those things. Hospice volunteers are needed, and you'd be doing a great service to that hospice company and to the patients and families it serves.